We're just delighted to see you here today. Um, it's a wonderful topic, and we've been real proud to be working on this project. Our presenters today, you'll hear from myself. I'm Marie Abraham, Deborah Dokken, and Suze Schrant, and Natasha Reed. We are all on the project team, the IPFCC project team, and yep, you see it right there. So Ushma Patel, who is also on our project team, is here, and she will be moderating the chat for us today. We also have Avital Havusha from New York State Health Foundation joining us, and you'll be hearing from her a little bit later. And then we are having a panel discussion today as well. And our panelists are Anjali Modi from the Children's Hospital at Montefiore, and Rosanna Ryan and Dan Hughes from Stony Brook Medicine. Next slide. So we have a lot to cover today. I just did a very brief introductions. You'll learn a little bit more about them, everyone, in a little minute. We're going to hear from Avital about the New York State Health Foundation, get an overview of the project, as well as an overview of the modules, which are, they are the core of our new resource, which we will be launching. And then we have a panel discussion, and you'll hear about the experiences of 2 of the 4 New York implementation sites that tested the resource. And then you'll get a very quick navigational tour of the resource. We hope to have time for Q&A at the end, so please chat in your questions throughout the webinar and chat them into everyone, but Ushma will be moderating and taking note of all those chats that come in. Next slide, please. So I'd like to welcome right now Avital Havusha. She's president for programs at the New York State Health Foundation. The foundation is the funder for our project, and I have to say we are just all so grateful for the tremendous support of the team, as well as Avital's support. So Avital, please come up.
Great. Thanks, Marie. So I'll just take a few minutes to introduce the foundation a bit and tell you how our history with this work and our partnership with IPFCC and the teaching hospitals here today. So we can just go to the next slide. So just an overview of the foundation for those of you who might not know us. We're a private foundation with a statewide reach, an overall mission of improving the health of all New Yorkers, especially the most vulnerable. So we fund and support projects across New York State in counties and cities across the state. In terms of our programmatic work, we support grants throughout the year, as well as healthcare policy initiatives and practice. So we do a lot of advocacy work, and then we help spread replicable and effective programs that work across the state. So a lot of times we're testing new models and then working with partners to spread them. So I'm going to go into a little bit of that work. We fund mostly projects in 4 priority areas. And one of our key priority areas is what we call empowering healthcare consumers, where this project has lived for the past couple of years. So if you just go to the next slide, I'll tell you all a bit about that priority area. So in terms of the context for this work and how we came to partner with IPFCC, our consumer empowerment area falls into kind of a 2-pronged strategy. One is our first strategy around greater transparency of data, including price, quality, patient experience information. A lot of that work has fallen in the policy sphere, really making sure there are both tools and regulations in place to make that information more transparent. And then I would say the work that we did with IPFCC in this realm really fell into what we call our patients as partners area. And we look to support patients having a meaningful role in their care, both in their own healthcare at the clinical level and at the policy level. So at the clinical level, we see that patients, as you know, should be empowered to have their personal needs and preferences met and really have a voice in their own healthcare decisions. And at the policy level, patients and consumers should have a seat at the table to help drive and inform decisions that are being made, both legislatively, but also at healthcare institutions. And we know that in practice, patients are often marginalized rather than placed at the center of the healthcare system. And so a core component of our work has always been focused on testing and spreading effective tools and strategies. And IPFCC has been a longtime partner of the foundation to further our goals in this realm. And our session today will really highlight how the knowledge and skills that health professionals gain over the course of their education can shape the interactions that they have with patients and families throughout their careers. And I would say that IPFCC and the teaching hospital partners, two of whom are here today, have designed a really replicable training model to better prepare professionals. And we're really excited to see how some of you joining us here today might be able to spread and replicate and add some additional ideas to the model that they've tested and built. And finally, I just really like to recognize the overwhelming dedication of the IPFCC team and the teaching hospital teams and what we know has been an immensely difficult 2 years during the pandemic, with strains on their own hospital systems, on the healthcare workforce, on their patients, on their students. And in many ways, the pandemic really did disrupt a lot of the relationships between patients and providers, and it put into stark relief really the needs of consumers and families. And I would say the partnership here today demonstrates that real commitment to work on seizing this moment to expand new solutions in the medical education sphere. And we're looking forward to the rest of the presentation, the input from the panelists, and hearing more from the audience here today. So thanks again to everyone for joining us, and I'll turn it back to Marie and team.
Thank you. Thank you so much. So I'm going to do just a quick overview of the project. Next. So why did we pick this topic as a project? So I have to go back a long time ago. I've been at the Institute for 26 years now, and we have been at IPFCC a champion for involving patient and family partners in the education of health professionals, really almost since our beginning years in 1992. So there are certainly exemplary programs out there, but what we found over the years is that there's a lack of robust and sustainable patient and family faculty programs in academic medical centers, and it's really quite unfortunate. It's missing a big perspective and a very important perspective and expertise. So this project was intended to address this gap by developing, testing, and disseminating resources for establishing a new program or for strengthening or expanding a current program. We started this project in November 2019, and we will be ending very soon. As you can imagine, COVID had quite a significant impact on the design and the way we implemented this project. Next slide, please. So we planned several goals for this project. What we wanted to do was build an understanding of the current state of patient and family faculty programs. We wanted to develop resources that prepare patients and family members to participate as educators, and for faculty to collaborate with patient and family faculty. We wanted to conduct testing of patient faculty training resources with teams from academic medical centers. And then we wanted to provide training resources to facilitate the spread of patient and family faculty programs across New York, but hopefully well beyond. And judging from what I saw coming up in the chat and where everyone's from, I hope we're going to be able to do that. Next slide. So we, to achieve our goals, we conducted a number of activities over the last 2+ years. We established a 10-member National Advisory Committee to guide and inform all the tasks. The committee included clinical faculty, coordinators, and directors for patient and family faculty programs, senior leaders and administrators, a dean of a medical school, as well as patient and family faculty. We conducted a targeted search of literature, resources, and programs in the beginning to find out what was going on out there in the field. And there is a selected annotated bibliography in the resource for you. We analyzed findings from a national study of patient and family faculty programs. Outside of the project, we partnered with Vizient to conduct a survey to explore the prevalence and functioning of patient and family faculty programs. But the analysis of the findings was included in our work scope. The full report, which includes our findings as well as some recommendations and gaps and opportunities for growth, is also included in the resource and available on our website. We developed a comprehensive online resource, which we will spend a lot of time exploring today. And then we engaged teams from 4 New York academic medical centers to test the training resources and provide feedback to help us revise and improve the resources before we set it out for the field. So in addition to Stony Brook and Children's Hospital at Montefiore, who are on the call today, we also had 2 hospitals from the New York Presbyterian system participating. And then we revised resources, and now we are in the process of disseminating those. So we couldn't have produced the resource without the continuous review from our National Advisory Committee members and our internal team in the development and testing stages. They were super instrumental. And also, I have to just honor the thoughtful testing by the 4 implementation sites. We're really grateful to everyone for their time and their efforts. Deborah, hand it over to you.
Next. Thanks so much, Marie. I'm going to do a very quick overview of the content of the modules, and then a little later in the webinar, you will actually be introduced to how to navigate the modules online. Next slide, please. So this resource is organized around 3 modules, each that has sections or subparts. And the 3 modules are meant to be integrated and to have a flow or sequence. So we do recommend starting with module 1. Another intent in designing the modules was that this would be developing a program and working through the modules would be the work of a team or some kind of work group within an organization. The titles, I think, really describe the content of each of the modules. So module 1 is really focusing on why is it important to develop these programs and to partner. Module 2 is the question, how can we build or develop a program? And module 3 is looking at where we are in our own implementation process. How might we learn from the experience of the field? The modules, all 3 of them, rely heavily on the voices or experience from the field through interviews that we conducted. And these voices, as Marie mentioned before, are leaders in academic medicine, program coordinators, and patient and family faculty members themselves. Next slide, please. So module 1, Making the Case, has 2 sections. framing the issue and framing the solution. And by the framing the issue segment looks at things like the complexity of healthcare right now, the need to build those relationships that Avital talked about, and then particular issues like the opioid epidemic. And that part of the solution to educating new healthcare providers about these issues is to incorporate the lived experience of patients and families. Like the other modules, Module 1 has a resource section. Marie's already talked about two parts of the resource for Module 1, namely the bibliography and the Vizient report. This module is close to 30 minutes in total time, but we also have developed a shorter version that's really intended to use with leadership, because when talking about making the case, it is so important to have leadership on board. Next slide, please. Module 2 is really getting into the nuts and bolts of developing a program. It has 7 sections ranging from identifying and understanding your own challenges as you start to develop a program, to how do you prepare patients and families as well as clinical faculty for doing this work together. This module, the 7 sections are meant to go in sequence. And Module 2 is where we introduce a program action plan that is also part of the resource. And again, this program action plan is meant to use with the team or work group. Again, there are resources in this module. An example is there's a separate piece on recruiting and supporting patient and family faculty members. This module is just about an hour in duration. Next slide, please. The third module has 6 sections, and unlike the prior module, it is not meant to do 1 through 6 in order, but instead, this is where the team using the resource would make choices based on where they already are with their integration of patient and family faculty members. So some people are starting a program, some people are ready to expand, and some people have reached the point where how to sustain a program and really ride out transitions, et cetera, is a key issue. And this module relies heavily on hearing from the experience of others in the field who both share their experiences but outline key steps for these different stages. This is also an opportunity to add to the program action plan. The sections in this module range from about 3.5 minutes to 10 minutes, so they're quite short. Next slide. I've referred at least twice to the program action plan. This is available in a separate tab in the resource, but the plan itself is fillable, and you can complete it online or you can download it and complete it in hard copy. And again, the intent is that the team would work on it together. Next slide, please. So I wanted to end with this quote from a medical student with whom we had the pleasure of working, who really reminds us of why this is important. to integrate patients and families. It's not just for the immediate and actual education, but ultimately for improving the quality of healthcare. I'm going to turn this over now to my colleague Sue Schrantz, who will facilitate the panel and share the experience of our implementation sites. But I want to add my gratitude to that of Marie and thank the sites for their thoughtful feedback. And we really, as a result of that, made changes that made this a better resource.
Great to be with all of you. I'm Suze, and I will again echo the gratitude to our implementation sites. So important to bring this work to life, and so we're really grateful for your time and energy. And special thanks to our panelists today, Anjali, Rosanna, and Dan. It'll be great to have your lived experience from this work. So before we get started with the questions, I wondered if each of you could just, in one sentence, share what your role is at your organization. And maybe we'll start with you, Anjali.
Hi, everyone. Thank you, Suze. And thank you to the IPFCC for everything you guys have done. This has been a very exciting new journey for all of us. So thanks again. My role is a patient family advisory council, hospital liaison, and I also wear the quality and safety hat. So I do both. And this is at the Children's Hospital at Montefiore, located in Bronx, New York.
Great. Thank you. And Dan?
My name is Dick Hughes. I am a member of the Patient Family Advisory Council at SUNY Stony Brook Medical Center. I was invited to be part of that group after an experience as a family member of a patient at the hospital.
Great, thank you, Dan. And Rosanna?
Yeah, hi, everybody. Thank you for participating today. My name is Rosanna Ryan. I'm the Director of Patient Advocacy here at Stony Brook University Hospital in Stony Brook, New York. And I'm also the liaison for our Patient and Family Advisory Council, our hospital-wide council at the hospital.
Wonderful. Great to have all three of you here. We're really appreciative of your time and your willingness to share with us. So, we've all been through quite a bit the past couple of years. Curious, even with the stress of the pandemic, why did you each want to be implementation sites for this project? And Rosanna, I'll start with you this time.
Sure. I thought I'd have to really think about this question. And, when we received word that the Institute was working on this and that it would be with New York Academic Medical Centers, we were it was such a spontaneous yes. There was really no hesitation despite, COVID. Our Patient and Family Advisory Council is, for lack of a better term, a COVID council. We started in August of 2019. So we didn't have much opportunity to have a normal council experience. Pretty much we went from August to February, and then everything was virtual after that. So for us, it was very important for us to really identify an opportunity to collaborate with our advisors in a very meaningful way. And, we were struggling with that a little bit with COVID, just trying to navigate that. And, how do we engage with them in something that's meaningful and safe? So we saw this as an investment, not just in Stony Brook and the patient care, but also an investment in our advisors. We really wanted to give them that opportunity, and we were seeking and really yearning for that opportunity to partner with them in a very collaborative way. So that was our thinking behind participating.
That's great. Thank you. I'm so glad you did. And maybe Anjali, if you could answer this one too.
Yes, absolutely. I will echo the similar sentiments as Rosanna. We first heard about this opportunity through senior leadership, through Dr. Hammets. She has a great working relationship with IPFCC, and she thought this would be something that our Family Advisory Council would be interested in. And honestly, same thing. I think on the flip side of the stress of the pandemic, I think people are still, even now, craving interactions, whether it's virtual, even though I'm sure everyone's exhausted with that too. But this is something, like she said, that's meaningful, and it was an opportunity to connect and actually have a say and feedback into what is being developed. So we thought it was a great opportunity to take part of.
Great, thank you. So thinking back, after you decided to take this on, is there any practical or feasible strategies that you used to complete the modules, convene the team for planning? How did you manage committing time, scheduling these discussions? And this question is going to start with Anjali and Rosanna, and then Dan, I'm going to have a specific question for you next. So maybe Anjali, if you want to go first.
Sure. I was thinking about this, and I think the easiest thing to say would be, and I wish my team, I don't really know if everyone was able to join or not, but I think our team being so bought in from the get-go was probably the key for it being possible, honestly. It's as simple as that. We had buy-in from senior leadership as well as from 2 physicians, myself, and 2 parents, and everyone, we worked together. And I think the other piece that made it easy was the buy-in plus everyone working together with just scheduling check-ins. So we scheduled them out for the duration of this whole time frame, and we made it. So it was fun. We tried to keep it simple and easy too. If anything was if we didn't really need to spend too much time, we just kept it quick and made it easy because we also were mindful of the parents' time.
Great. Yeah, that buy-in is so key, and simplicity. Great points. Rosanna, how about you?
Yeah, the buy-in is essential, and we were just as fortunate as Anjali. We had physician buy-in, we had buy-in with our chief executive officer, as well as our dean with the school, our council. We have amazing advisory council members who, as I said, were yearning as well to really collaborate in something meaningful. So the interest was there, to do this. I think the thing for us, and I will say probably that COVID did help us with, was our ability to be more flexible, as far as using technology to facilitate a lot of our discussions. So just like we're having our webinar, we utilized our Teams platform, Microsoft Teams platform, to be able to meet with each other. We utilized email for those discussions that didn't need a full-blown meeting. Early on, we really laid out what was expected of everyone, what the goal of the project was, our estimated timeline, the time commitment it might take, so everyone could really, evaluate what they had going on to make a good decision on if it was something that they could actually participate in, and really, open communication. I think all those things really helped us be able to meet our goal successfully.
Great, thank you. And Dan, would love to know from your experience, what was it like working with the team virtually?
Again, I'll echo that we've all kind of gotten used to it, I think, for better or worse. So, working virtually was convenient a lot of times. More convenient than probably trying to get together. I think it allowed us to accomplish more in a probably shorter period of time than it would have if we had to try to do it in person. Honestly, I think trying to coordinate everybody's schedules would have been a lot harder without that piece of the puzzle.
Great. Yeah, I think we all, who knew Zoom would become such a household term? So I think we all feel that. Thinking about just the benefits, what do you see as the benefits, either right now or sort of down the road, anticipated benefits of engaging patients and families in medical education? Not sure who wants to start on this one. I'll leave it up to you all. Maybe you, Dan. What do you see as the benefit?
Okay, so I think that the biggest benefit obviously is improving the level of healthcare at the facility where it's being implemented. But in terms of why it was important for me to do it is kind of putting my money where my mouth is. Not just coming up with ideas for what's wrong or what should be better, but actually trying to participate in getting it there and seeing it to the finish line.
Great. So important. Anjali or Rosanna, anything more to add?
Yeah, I mean, I think what we've seen and what we've seen from other organizations that have a robust, faculty program is they do see the better outcomes and they do see the improvements in quality of care and they do see the improved patient experience. When we collaborate and partners with our patients and their families and they have the opportunity to share, the good things that they've experienced and the things that could have been better. It's impactful. It's more than a metric, and it's a story, and it's how it affected someone personally. And to be able to give a medical student that experience is invaluable. So, those are the anticipated benefits that I see down the road.
Absolutely, so important. Anjali, any thoughts on this?
Yes, and I'm going to actually read from one of our patient members who wasn't able to attend. So I just want to share what she said. She said, the benefits of engaging patients and families in medical education to me is, of course, better communication and understanding of the care the patient's needs, less room for miscommunication of expectations of care and needs. Patients have a clearer perspective and understanding of the procedures and/or medications needed. Medical staff get to know their patients more on a personal level, making them more comfortable to ask and share pertinent information for their care.
That's such powerful words. That's so important. So what's next? Have you come up with a plan to move forward? And what does that look like? Maybe I'll start with you, Anjali.
So our team, so we did meet as soon as the modules were completed just to see how our experience was. And we think the one main priority right now is increasing recruitment, just because we want to make sure we continue to represent our diverse community. We do have a really nice representation right now. It's just a smaller group right now, though. So I think that is one of the main things. And we've already started presenting to different groups like social work and child life and all these different folks, but also teaming with those who provide our medical education program too. So getting on their agenda and seeing how we can team together with what they already have and what our vision is.
Great. And how about you, Rosanna?
Sure. We actually have a meeting that we have scheduled in April with the administrators for our School of Medicine to talk about next steps. So we're really looking to identify some small steps that we can take to start integrating and collaborating with our patients and families in several areas. In addition to that, then we'll have a meeting with the entire team that worked on the collaborative on the modules to figure out how do we operationalize that. And one of the things we recognized as well that Anjali mentioned is that, I say all the time, we're small and mighty, small but mighty, but we do need more. We need some help. We need advisors. So we have our next meeting, our advisory council meeting is Monday. And one of the topics that we have on there is, real tangible things that we could do to start with recruitment. So in addition to speaking with different disciplines, really coming up with a website for our advisory council that people can look at and see, why do I want to be an advisor? What are some of the things we could do? How do I get more information? So our advisors are working with a member from our team to create that resource and, that recruitment tool really. But that's one of our goals for this year is, we've identified we really need to recruit more advisors so that we can operationalize this successfully. But those are our next steps.
Great, a lot of activity envisioned. And I know our implementation sites from New York Presbyterian weren't able to join, but they did share sort of in their immediate forecast, they are initially focusing on sort of patient storytelling with all of their PFACs. And then a little bit later, we'll think about how to use the training to help further the family faculty program. So I think it's a lot of figuring out what you can do now and what's long-term. So lots of exciting work envisioned. We're at our last question, and this is really key, and I'm sure many people will be eager to hear these answers. I'm going to start with you, Dan, coming from the patient and family advisor perspective. If you were talking to someone interested in patient and family engagement and medical education, what guidance would you have? How would the modules help them?
So the first thing I would probably say is that, and I think it was maybe some of my hesitancy for getting involved in the first place, was every opinion matters, every experience matters. So being able to share that, it can have a really profound effect. I've learned as being part of the PFAC that you can start to implement change, and you can make progress in getting things going in the direction that you wish was your experience when you were there, or when your family member was there. I think that's very important, and the modules definitely help kind of steer that in the right direction. You know, having come from an experience as a family member, I would of course focus probably way too much on that part of it, and the modules had other parts that I didn't necessarily think of as important components to implementing and making it really work in these settings.
That's great. Really, really underscoring that everyone has a role to play, and helping encourage patients and family members to speak up and be involved. I think that's
And
great.
staff as well,
And
not just us.
That's great. That's great. How about you, Anjali or Rosanna? What would your guidance be? How do you envision these modules helping folks?
I can go. So I think a simple thing is to think, probably even just how I thought too, how do we navigate this? What are we doing? Even before the IPFCC approached us about this opportunity, in general, how do we build a family advisor council? All those questions. I think this might be a helpful way to just start, like step one, a foundational resource tool. So instead of going through multiple errors and things that you are, trying to figure it out yourself, it's kind of using the expertise that is already out there. So I found it helpful in that way.
That's great. That's great to hear. And Rosanna, how about you?
Yeah, I saw it as a roadmap, and that's how I thought it was helpful. It was an outline. It was steps to take to help guarantee success, push you in the right direction of being successful. It served as a resource for if you didn't have Anjali and I had the good fortune of having senior leader support with this, but if this is something that you were interested in and you didn't have that support, it gives examples of how to get that leadership buy-in, so there's something in it for everyone wherever they're at on their journey. And then, as far as resources, there were so many resources and ideas and examples from other organizations that already had a robust team, advisors who already were participating. They talked about the benefits and what they got from it. So just from that perspective, I think the modules were invaluable.
Can I add one more thing too?
Sure, please.
I was thinking as well, I completely should have given credit to this. So I thank the IPFCC for connecting me with some folks too. So outside of the modules, as I was trying to think outside the box, like how do we continue this and keep connecting? So I think you guys connected me with another patient family advisor member, maybe from Kansas Mercy Children's Hospital, I believe, Dijo. She and I had a 1.5 to 2 hour conversation one day, and it was phenomenal. I got so many takeaways. She shared all these handouts for me. And so the reason why I bring that up is I think it also is a available network now too for folks. So if you're willing, you know, if you want to connect with people, it's another opportunity.
Yeah, that's great. There's so much we can learn from each other. So I think that's a great point to add. Well, I think we're at the end of our time for this discussion. I just want to thank all three of you so much. This is where if we were in person, we'd give you a big round of applause, but really appreciate your input and all of your time and energy. And I think I'm going to hand it back over to Marie.
Yes, thank you, everyone. That was terrific. I'm going to hand it over to Natasha in a second. I just wanted to be totally transparent about the process we put these implementation sites through. I think our timeline for review of the modules was 6 to 7 weeks, if I'm not mistaken. We might have extended it a little bit to get more feedback. And it was really surprising to see how committed all the teams were to, go through those modules in a very tight timeline. We would never ask, or we would never expect anyone who's viewing these modules for the first time to do that timeline. So I just thank you so much, because everyone was so energetic and so wonderful about providing your insight. So sorry to take that away from you, Natasha, but I'm going to hand it over to Natasha.
Will give me just a second. We're going to go through navigation of our site. Okay. Thank you for visiting the Patient and Family Faculty website. We suggest you view this website on a Chrome browser and not in Safari. After reaching our site, you'll want to sign in or register. You can do both of those things under the My Profile tab. Logging in and registering is required in order to view our modules. If you're a returning user, you can simply log in at the top. If you've never used our site before, please scroll down just a little and go ahead and fill out our registration form. Once you register, you'll have immediate access to the modules. After logging in, your My Profile tab will look like this, with a large blue box at the top and your name in the middle of it. From this page, you can click the Modules tab to view our modules and sections. Before we get into our modules, I want to take just a second to point out our Action Plan tab at the top. Under this tab, you'll find a downloadable version of our action plan as well as other supplemental materials. Now let's move over to our Modules tab. Under our Modules tab, you'll find a Start or Continue button here on the right-hand side, but you'll also find 3 inner tabs in the middle. Here you can see an overview of our modules, a modules outline that provide direct links to each section within the modules, as well as our expertise page. In order to access the modules, you can click the direct links listed under the modules, or you can click Start or Continue on the right-hand side. Each module begins with an introduction that provides some background as well as the length of time for each section. Each module ends with a resource section with resources that are relevant to the module. You may want to download some of the resources before you begin a module. We recommend that you view each section in its entirety. When you enter your modules, you'll notice that on the left-hand side of the page there is a small blue arrow. This arrow collapses and expands the module outline. The module outline provides direct links to different sections within the modules. If you would like to move through the modules in order, you can start with the Module 1 introduction. At the bottom, you will see the Next button. Clicking the Next button will bring you immediately to the following section. Each section has a Complete button at the bottom. The Complete button is used to track your progress through our modules. You can move on without completing, however, if you click the Next tab. If you would like to mark a section as complete so that you can track your progress, please click Complete and then Yes. After clicking Yes, the page will reflect your completion. When you'd like to exit our modules, or if you'd like to return to the main site, please click in the top right-hand corner Back to Module Outline. This will bring you back to our modules and the outline of each section with direct links. If you'd like to exit our site or log out, please hover over your name in the top right-hand corner and click the Log Out button. If you run into any issues or questions, please contact us. You can contact us under the Contact tab. With your name, email, and message, we will reply to you as soon as possible. If you need immediate assistance, please email Natasha Reed at nreed, R-E-E-D, @ipfcc.org. Thank you so much for visiting our site. We hope you'll find it useful. So that is a very brief walkthrough of the use of our modules. If anyone has any questions, please feel free to contact us through our Contact tab, as well as emailing me directly. My email address is nreed@ipfcc.org, and I'm more than happy to help you navigate or get in. And I'm going to hand it back to Marie.
Oh, thank you, Natasha. We couldn't have done this project without Natasha. So as you can see that we designed this resource as somewhat like a online course. Was our vision. Now, originally our vision was to do workshops in person and use a train the trainer model to develop resources. But we obviously had to shift gear when COVID happened. Here is a link to the site. It is up and ready for you to view and use. It has changed somewhat significantly since our implementation sites looked at it because of all the feedback that we received both from our National Advisory Committee as well as our patient and family advisors, our implementation sites, as well as our internal teams. And one of the feedback, one of the comments that we got was that it would be helpful to have a written resource that you can download and take a look at to understand the content, the flow, as well as the site navigation itself. So we did develop a resource. It's available on or will be available. I'm not sure, Natasha, if we've gotten that up yet on the patientandfamilyfaculty.org website yet, but it is available currently on our website in one of our best practices section on partnerships in health professional education. So we hope that you do use this and go visit it. And one thing we definitely want to have back from you is feedback. How are you going to use it? What do you think? It would be helpful for us to use that contact page also to get in touch with us with feedback. So I think we're going to turn to Q&A. Next slide. And if everybody could come back on camera, excuse me, and off mute, that would be great. And I'm going to turn it over to Ushma, who's been moderating the chat for us.
Thank you, Marie, and thank you to all of you for attending and just a wonderful presentation today. We have one question that was submitted from Lisa Maurice, and she is asking, what guidance do you have around training patient and family advisors to be educators and training educators to moderate PFA presentations or panels? So Marie, Deborah, Suze, I don't know which of you want to address that question.
I can start it, and Suze, maybe you want to pick up on it. In the modules themselves, you're going to find a section that has a lot of information about preparing how to share your story for the different roles that patient and family educators play. And I will say that we also went to 2 exemplars to get information about the workshops that they hold for their patient and family educators. So it's not only about presenting on a panel, but also sharing their stories in the different roles they might play as a patient and family faculty member. As far as, it's a good question about preparing the staff to facilitate a good panel. We do have some resources on that, and I'll have to go back and get back to you, Lisa, on that, because we've certainly written about how to facilitate a panel effectively in the past. But Suze, I don't know if you have something to add. And I guess we should have said, Suze, that you are a very well experienced patient faculty member yourself, which is one reason why we brought you into this project.
Yeah, I echo your answer, Marie. I think there are several resources or just segments of the module that I think could be helpful for sort of both of the questions here. And then I know IPFCC has lots of additional resources and materials, but just having done this for a long time, I am a patient in the rheumatology community. I've had a long-standing disease, and so I've been a patient faculty member in a number of programs since I was a teenager, actually. About 18 years old, I think, is when I started my first one. I think kind of the golden rule is just to think about everything in the spirit of co-creation. And so it's co-ideation, it's co-building, it's really partnering, working together. It's amazing how much you learn from each other when you kind of just embrace that approach. But I would just echo that if you look through the modules and look through some of the supplementary resources, we really tried to give some pretty step-by-step guidance for what it looks like to do this work. That's why I don't have a quick answer, because it takes a little bit of just preparation and thought. And so I'll like Marie, I'll go look and see what's available and be sure we point you to those resources. But just co-creation in everything you do, I think, is the golden rule.
Susan Marie, because I happen to be looking at the program action plan tab in the last couple of days. So in addition to the actual program action plan, there are 3 other templates that are downloadable under that same tab. One is helping organize around storytelling, but there is a simple 1 page on, and you use the term co-design, Suze, but it's the patient and family faculty member and the clinical faculty members sort of going through the steps of whatever it is that they're doing together. What is the purpose of our presentation? Who's the audience? So there are some fairly concrete tools, as well as the theme of storytelling is really embedded throughout the resource.
Thank you, Deborah, for that. We are approaching time, and I think we have time for one more question. Renee actually posted this in the chat. She wanted to ask if patients and families are compensated for their time, energy, expertise in medical education. If so, at what rate, and what have the discussions been like on this topic?
I might go to our implementation teams to respond as well.
I could share.
Yeah, okay, great. And I will say that we definitely encourage the compensation of patient and family faculty, patient and family advisors. I think without it, you're going to have a difficult time sustaining your patient and family advisors and faculty who are representative of the populations you serve. So go ahead, Anjali, sorry.
No, that's fine. So I think, yes. So at our hospital, we do have, I can't speak to the exact amount, but happy to chat with whoever that was that wanted to ask. But yes, I agree that it is important to have some type of way to incentivize their time. So, and the way that we do it right now is for every member that attends and, actively obviously participates at our monthly meetings, we keep track of whoever it is and we submit it right away. So they get, they'll get a check mailed to them every month for that. So at least like something like that is definite, should be a thing. And, obviously before we went virtual, we were offering stipends for traveling and things like that, because we want to be mindful of daycare needs and traveling and, all these other things. So I think something like that is a good, simple thing to do.
I can share that at Stony Brook, we don't have stipends for our advisors, for the advisory council. We do not. We started having the conversation for stipends for the faculty, program. If when we get to that place, there would be stipends for that, but we haven't created stipends for our advisory council at this time.
Great. So Marie, it is 1:58. I'm going to turn it back to you to close us out for the session.
Sure. Thanks. And thank you again, everyone, for being presenters or panelists. It's been a terrific hour that's gone very, very quickly. Next slide, please. Deborah and Suze and I are available to you. So if there are some questions that we haven't answered today, you can definitely get in touch with us. We're happy to chat about that. And I see that there might have been a chat response to one of the questions. Please stay connected with us. And especially we want to hear if you use view the modules and use the action plan, we definitely want to hear from you. Next. Also stay connected with us at IPFCC. So I know that networking and keeping you all connected with each other is something that we really feel strongly about. So we have an online learning community. It's free. It's PFCC Connect. If you're not a member, you can join at this link here that I think Ushma just put into the chat. You can also email us at the Institute at ipfcc.org. That's our general email. I actually am the one who responds to that email. Next. Well, we definitely want to hear from you about our webinar today, and it just helps us keep improving. So if you are so inclined, we encourage you to complete this survey when we end the webinar. And we are exactly at 2 o'clock. So I want to thank everyone for joining us today. And I look forward to hearing some more from you, all of you. Thank you very much.